Good afternoon, and thank you for joining us today on the program Healthy Living. I'm Adesuwa Usa Uwagye. Today we want to look at the eyes. A lot of us know that the eyes is quite important. Some knows very well that the eye is important, but yet they do quite a number of things to damage the eyes. Could it be ignorance, or that's just how they know how to do it? These are many more. Doctor is going to be talking to us about it. So we're going to look at several ways to care for your eyes. I think you should sit back, relax, enjoy the program, because your eyes are very important. They are the windows into your soul. And without the eyes, you know how it's quite difficult to live without the eyes. So we're going to look at several ways to take care of those beautiful eyes of yours. So I have with me in the studio Dr. Uwamari Ugbebo. She is an optometrist. It's nice to have you in the studio.
Thank you very much.
And you look good.
Thank you so much.
Eye care in child. Okay. I see that you're very passionate about children and their eyes.
Yes.
Okay, talking about children, before we go into what we have today, we see quite a number of children with eye problems. Can you tell us why?
We could just say it's as a result of exposure. Children nowadays, they even know how to use our gadgets more than we, the adults. So we'll be so shocked on how they can operate a lot of things inside the phone that we don't even know, some apps inside the phone that we don't even know they exist in the phone. So constantly exposing their eyes to those gadgets can cause 1 or 2 eye problems for them. And then maybe when they are playing as well, they tend not to be careful with what they play with. So they come up with some of these eye challenges. Some other children, it's not their fault. They are born with some congenital eye disorders. So we can't rule that out.
Okay, when I see children with glasses, particularly toddlers, you know, it gives me cause for concern. I usually feel very, you know, somehow, I just feel so, I don't want to use the word, I just feel somehow. I'm not usually very happy.
To put on glasses.
Yes, they are too little to put on glasses.
Well, if that's what is going to make them see properly, there's nothing wrong about that.
And that's going to be like for life?
Not in all cases. If it's genetic, probably they are using high power. Definitely they're going to use it all their life. Then some other cases, astigmatism as a result of exposure, like I said, to computer gadgets. So if they start protecting their eyes, the condition can just go away. So it depends on what condition that's making the child put on their glasses.
Okay, let's look at children that were born blind. Any hope for such children? Because sometimes you hear things, oh, there's some kind of things you can do with laser this, laser that, there's this kind of surgery, there are other kind of surgery that can help these children. What kind of surgery can help children, and what kind of condition can surgery, you know, help?
Take care. Okay, so there are different blinding conditions. If the child is born with congenital cataracts, we can take the child for a small incision cataract surgery, and that child will still regain vision, even if it's not as perfect as the child or the parent might want it to be, but at least there's some extent of vision restored. Then some other children may be born with full-blown glaucoma. Glaucoma, of course, it doesn't have care, it's only managed. So if the child is born with glaucoma, there's hardly anything we can do about it.
What could be the cause of that? The child being born blind, the child born with
hereditary,
full-blown glaucoma.
then what the mother is exposed to during conception.
Well, like what are those things? We need to know, because there are so many pregnant women out there who do not do antenatal, who do unorthodox medicine and all of that, and some are they're just like that. When the baby comes, you know?
And there are some herbal preparation that some women take that can expose the child. There are some drugs too. Like if you want to take any drug as a pregnant woman, you need to seek your physician, or if you can go through the leaflets. If it's safe for you to take during pregnancy, go ahead. If it's not safe for you to take during pregnancy, then you should desist from taking it, because that can go a long way to affecting the fetus. And also, even when you're breastfeeding too, you mind what you take into your body. It might go a long way to also affecting the fetus or the child that you're breastfeeding.
Wow. So pregnant women should be very careful. Yes. Anything can happen. You know, I keep saying that we faith a lot of things. There's no harm in faithing things. There's no harm in having faith in what you believe in. But you must also do the needful so that your child will be healthy. If your child is not healthy, you're the one who is going to suffer for it. You're the one who is going to do time for it. Okay, you're the one who's going to spend energy, money, and your emotions. So why not do what you can to avoid all of this? It will go a long way. And for those who are used to herbal mixture and all of that, you may be putting that baby of yours at risk, okay? And are there herbal remedy for the eyes? Because you hear people say, okay, go use this, go use that.
None that I know
go
of.
use the leaf of life, go use that one.
It's really leaf of life.
Yes, then squeeze it into the eyes and you'll be fine.
None that I know of. None that I know of.
So what are those things that could go on with the eyes, whether for adults or for young ones? What are those diseases that can, you know,
okay, part of what we're going to be discussing today. Happy Valentine to everyone. Today happens to be Valentine Day and we are having this head talk.
Yes,
it's
our Valentine gifts to you.
You need to love your eyes. You need to love your eyes. Now, today being Valentine Day, our thoughts are shifted to those we love, our relatives, our significant ones, our family members, friends, and even our pets. We've shifted our attention to them, to show them love, to reciprocate in one form or the other. The same thing happens to your eyes. Your eyes are doing a lot for you, helping you to see, to love, to be able to even read the mind of people. You can look through the eyes to do that. So you should also take care of the eyes, show the eyes love, and that's what we'll be talking about today. 8 ways to love your eyes.
Okay.
The first one I'll be talking about is limit the time you spend on your screen. The gadget comes into play here. What you expose your eyes to, the television, your computer, your phone, anything that takes your attention, anything that you have to concentrate so much to do and it has to do with the screen, you have to limit the time you spend on it because on the long run, it has damages, effects to the eye. You can apply the 20-20-20 rules, which is looking at your screen for 20 minutes, taking your eyes off the screen for another 20 seconds and looking at a distance of about 20 feet off, or you could blink for another 20 times, and that could help to restore your vision back and reduce eye fatigue in the eye. That's one thing that we can use to take care of our eyes. Okay, so how can one know that, no, this is it? You just said the 20-20 rule. Not everybody knows that rule. I didn't even know about that rule until you said it now. So that's what we are giving out now.
So please talk about it extensively.
Now, if you...
20-20 rules, because we need to understand what these 20-20 rules mean. Okay.
For example, you're with your phone, probably reading with your phone or having some social works in your phone. You look at your phone for up to 20 minutes, then take your eyes off the phone, look at a distance of about 20 feet for another 20 seconds before going back to your phone. Don't just keep gaze on your phone for a lengthy period of time, like up to an hour. It can cause eye fatigue. And also the amount of light that is entering into the eyes too has a way of also affecting the blood vessels, the rods and the cones in the eyes.
Okay.
So that's what 20-20-20 is all about.
20-20-20.
Yes.
It's all about. Yeah. Okay. Well, there are some persons who work with the computer day in, day out. Okay. And then they hardly take their eyes off it for several hours.
Okay. So now those people that work with the computer, in fact, it's almost impossible for us to avoid using this gadget because it has come to stay and it has made our work easier. So we can't tell you to desist from using those gadgets. So what we intend to do as doctors, we'll advise that you get Photochrome glasses that protect the amount of light that falls on the eye. Once you're wearing that type of glass, you are good to go. You can use your screen, still applying the 20-20-20 because that doesn't take so much time from you. 20 seconds is just a very minute time. So you use that photo glasses. They are blue cut glasses. They block about 99 to 100% of the bad light that's supposed to fall into the retina. And then your eye is protected that way. We have a way of reaching out to those that work in the banks because we know they are very busy to come out. So we give them seminar, give them head talk about this exposure to the computers and how they should manage it. So a lot of them are using these blue coats, and that's what I'm wearing anyway. A lot of us are using it, and it's very effective. It helps a lot. It saves the eye from fatigue and exposure.
All right. What about, it's like the use of telephone has done that's the handset, and have done quite a lot of harm to people's eyes, because you see quite a number of persons complaining about the eyes, yet they do not want to wear glasses because, they will feel stigmatized, or they say there is this thing about glasses. No, I don't want to use glasses, They have this awful feeling towards wearing glasses. They don't want to wear it, all right? So what can we do to help?
They are not doing themselves any good. We've tried our best to always sensitize. We've tried to always talk. Like you see what I'm putting on, Eyes for the Future. We are saving our eyes for the future. We capture the little ones. Who takes care of these little ones? It's the parents, adults, their guardians. We talk to them. Some of them are not even willing to listen, but the ones that are willing to listen, at least we know that those people are safe from the population. So we still keep talking. We won't stop talking. Protect your eyes. Use the protective glasses anytime you are exposed to gadgets. And even those people that work with and that are exposed to in their workplaces, that's the environmental hazard, like the weathers, people that are wed. So they have protective goggles that they can use also to protect their eyes, so that light that comes out when they are wedding.
I see quite a number of them. They just use this normal sunshade. I know that there are protective goggles for them, but they just wear this normal sunshade.
It doesn't protect all around because they can see what I'm putting on. The face of it is protected, but there's space here. The fire can escape through this place. There's also space here. Yes. But their own protective goggle, everywhere is covered.
Let me just quickly wear my own now before we'll start speaking another English. Okay.
Everywhere is covered, so it's protected all around. So if they don't want to put on their protective goggle, they are doing it at their own risk. If maybe any metal fall on their eyes or anything goes wrong while they are walking, then they have to come to us. We'll make our money. We'll make our money. We remove the foreign body, or we treat for scars.
Something that they can easily have avoided.
Yes.
Okay, let's see the second point now.
Okay, the second point is know your risk factor.
Okay.
Are you born into a family where you know that there's history of hypertension, diabetes, there's history of high cholesterol? Then you know how to protect yourself, because these things has a way of giving feedback to the eyes. It can cause hypertensive retinopathy, diabetic retinopathy in the eye. So all this condition I just mentioned, they are blinding condition over time. So since you know that you are exposed to things like that, you should also know how to take care of yourself. If you are born into a family that there is history of blindness, you should know that you should have regular checkups. For example, in a family where they usually have glaucoma, or at a certain stage in their life they get blind, then you should know when to visit your doctor. You should know what tests that is needed to carry out. And all these things can only be made known when you visit the hospital. That's another thing. Know your risk factor. Yes.
All right. So when one is born into a family of those suffering from hypertension, diabetes, and blindness, they would have all of the. What about those who are not born into it and still have this condition?
Yes, it's possible. So we have the inmates, that's those born with it, and then we have the acquired. So those persons, they acquired the condition. That's why even if you think that you don't have any eye problem or what have you, like every 2 years, 24 months, there's need for you to just visit, do a routine eye check. Do a routine eye check.
Every 2 years.
Yes, you do a routine eye check to find out if you are completely free from having any of these problems that may want to affect one's health. So
when one come down with, or one is affected with all of the, maybe somebody born into the family of diabetic issues, and then they have this diabetic retinopathy, hypertension, retinopathy, and all of that, what is that person supposed to do? How would that person even know that this is the problem? Because we have a very, should I say, very, very bad attitude towards assessing medical health. We don't want to go for any medical checkup until there is an emergency.
When you go for medical checkups, you spend money. People don't want to spend money, as in they don't want a situation whereby you just go for only consultation and you pay for consultation to see a doctor. You pay for drugs that you might probably not even use the way it's been prescribed, you know. So they just feel that anytime I have chance, I'll go for that. I don't have the time. They want to make money, but they don't want to give out money to take care of themselves. And it's only when the condition has become so bad that sometimes it's even irreversible. That's when they come crying. But there are a lot of people that still come to the clinic for a routine check. We still have people like that come to the clinic for a routine check. Okay. And they get diagnosed, or we'll tell them they are free of any form of visual challenges. So just visit the clinic, get diagnosed of whatever problem it is, and then we manage accordingly.
You know, I always wonder why we have to wait until something really goes wrong before we visit the hospital. This bad attitude to us, I'm saying us now, because sometimes some of us could be very guilty of this. We wait till there is an emergency before we go.
And so sometimes it's not even ignorance.
It's not ignorance. It's just maybe carelessness, negligence. This lackadaisical attitude to all of this, you know, we do that a lot, and then we fate it. It's not my portion and all of that.
Exactly.
Wow. Exactly. Okay, let's go to the third one then and see. Okay. Before we go take the news at 3 o'clock. We'll take the news at 3 o'clock, and then immediately after the news, we will come back to conclude what we're talking about already. So we'll just do something up to that time, okay?
Quit
so let's look at
smoking. Number 3.
Smoking is a problem.
Quit smoking. Smoking affects the overall health of anybody that is exposed to it. Smoking can affect the heart, it can affect the lungs, it can also go a long way to affect vision. Smoking can cause blurry vision over time. Smoking can cause retinopathy, it affects the retina. Then we now have to start managing. So it depends on what stage that you are able to access the health care, then we pick up management. But it can be avoided if you quit smoking. Then another point is body mass index. Okay. Body mass index, obesity. So obesity has a way of affecting the heart as well. Obesity has a way of introducing fats into the body, and as well causing blurry vision. So
how does that happen?
Obesity is it affects women mostly, because we have that natural fat in us. So when it becomes excess, it makes vision blurry. It affects the lens, it makes vision blurry. Just the way sugar, diabetes affects the lens as well and makes vision blurry. Sometimes these vision loss, they are irreversible. Some other times we have to just manage. Most blinding condition, at the end of the day, we have to manage. Even those of them that has a surgical intervention might not give you that crisp vision that you expected at the end of the day. So the whole thing is just avoiding a lot of things that you know is harmful to your head. Anything that's harmful to your body, the eye is part of the body. Definitely. It affects the eye as well.
That's wonderful. Now, you've talked about 4 points already. Now let's look at the issue of eyelashes. You know, ladies will wear eyelashes a lot, and I actually saw something on social media where a lady went to fix her lash extension, and then she got caught up in a serious serious fight with the beautician because some liquid dropped into her eyes and she couldn't open one of the eyes. You know, you give us that answer when we come back from this. Dr. Wamari will give us an answer to that. If eyelashes is dangerous, that's not the natural ones. Now, you know, we have extensions that will fix. Some could be very long, others short to the point that you wouldn't even know if the person is wearing any extension at all. So when we come back from this break, she will tell us if it's dangerous or not. Thank you very much for joining us on the program, Healthy Living. What is the kidney?
The kidney is an excretory organ in the body, which is for metabolism.
Tuberculosis affects many organs in the body, but the common ones it usually affects is the lungs.
Epilepsy is a neurological problem.
Okay.
It is an injury in the brain, which causes someone to begin to convulse, to go into fits.
It is curable, but the cure is a long-term thing.
If you eat well and avoid those risk factors that will make your immunity to be down, then the risk of contracting tuberculosis will be reduced.
If you're healthy, then you're wealthy. A pleasure to have you join us again on the program, Healthy Living. I'm Adisuwa Sawagye, and I'm speaking with Dr. Wamari Ogbebo. She is an ophthalmologist, and we're here, optometrist rather, and we're here doing our thing. Okay, doctor, you've been giving us points on how to take care of our eyes. When we have substance going to our eyes, what do? Like some chemical substance going to our eyes, maybe when we're fixing, particularly when we're fixing this eyelash extension, so to speak. So, is it safe to do that?
Yeah, if you have any chemical splash into your eye in whatever form, the first thing you need to do is first aid.
Okay.
Flush. Just keep flushing with water, just normal water.
Just be pouring water in it.
Just be pouring water in it. If you have syringe in the house, you can tell someone to help you withdraw, so that the water goes directly without the needle, so that the water goes directly into the eye. Flush, keep flushing and flushing before you seek medical attention. But just keep flushing. That's just the way to take care of. That's the first aid in taking care of chemical splashing to the eyes.
So, is fixing of eyelashes safe?
For cosmetic purpose, it's safe. It's okay. It's okay. Just that the weight of the eyelash should not be much. Like those very long ones, they have a way of dragging the muscles of the eyes down. What I know, that it has effect on the eye muscles over time. So if you are the type of person that uses your eyelash occasionally, like if I have some kind of function I want to attend, I use a very short eyelash, and immediately I'm back, I take it off. I don't keep it too long on my eyes. Of course, it makes a woman look beautiful, so we can't ignore that beauty part of a woman. You can use your eyelash, but with precaution, and you don't need to leave it on your eyes. Sleep with it, wake up with it, continue every day with it. It becomes like a natural look, and by the time you take it off, you look weird. So you just use it in moderation. Use it in moderation when the need arises, when there's important need for it.
Okay, I've often seen people complain about contact lenses, while some are cool with it, others are not cool. What's the risk in using contact lenses?
Contact lenses, first of all, before putting on your contact lenses, is one of my points, hand washing. Make sure your hands are properly washed, because if there's a little dirt on your finger that you want to use to insert that contact lens in your eye, it will make the eyes totally red, make you feel like there's a foreign body inside your eye. So you must wash your hand properly before using your contact lens. Just like using normal spectacle prescription has its pros and cons, that's the same way contact lenses has its own pros and cons too. Contact lenses, it adds beauty in the form. We have different colors of contact lenses. So if you want to use your contact lenses, just make sure your hands are washed. One disadvantage about contact lenses is that the way we take care of it, you have to go by the rules. If you don't go by the rules of taking care of your contact lenses, it has its complication. It can affect the cornea of the eye. It can cause some giant papillae.
What's that? Giant papillae?
Is an allergic reaction in the eye it's like huge rash.
Okay.
Normal rash you find on the skin.
Okay.
It becomes very huge in the eye.
In the eye, inside of the eye.
And if you are using that your contact lens as a prescription, such that if you don't put on your contact lens, you don't see properly, then for that period of taking care of that papillae, you would not have to put on your contact lens. That means you won't see properly. So that's why using glasses also is an alternative. That's one of the disadvantages of using contact lenses. You have to maintain maximum hygiene when using your contact lenses. Yes.
And you don't sleep with it. You don't sleep with your contact lenses.
They are extended. Though it's not advisable to sleep with contact lenses. They said there are some extended ways. There are some extended ways that you can sleep with, but sometimes it's not advisable most of the time. It's better you take off your contact lenses when you want to sleep, because if you're on contact lenses, it needs air. It needs to be aerated all the time. So when you blink through, air enters the contact, it's safe for use, you don't feel dry eye. But when you're sleeping, your eyes are totally closed, no form of air goes into the contact, you know. So it makes you have dry eyes. Sometimes you can have irritation, the eye becomes red using contact lenses. So that's why most times if you are inactive, just take off your contact lenses and sleep with your normal cornea.
And that will be fine?
Yes, that will be fine.
Okay. Now, a lot of persons use eye drop for whatever reason. What's the risk? People just go to my eyes are red. You just go to a pharmacy, my eyes are red, I need eye drops, without seeing a professional. And then you get anyone and put into your eyes.
Yes, we come across that a lot, and we are still coming across it. A lot of people, they feel that emergency reasons, they'll just run to the pharmacy, and who are you going to blame? Are you going to blame the people that are going to the pharmacy shops, or are you going to blame the attendees at the pharmacy? So we don't even know. Sometimes they prescribe the wrong eye drops for them, and they are using the wrong eye drops. When it doesn't work, or when it's bringing up a serious complication, they run back to the eye clinic and say, this is what we have been using. You know, using an antibiotic eye drop, for example, we have precautions. Antibiotic eye drop is taking care of an infection. So if you don't maintain some level of hygiene properly, you can infect the eye drop, and when you instill in the eye, it reinfects the eye again. You understand? So you come into the eye clinic, we tell you how to use your eye drop. The dosage too matters. If you're supposed to use an eye drop 2 times a day and you're using it 3 times a day, especially for those people that don't like reading leaflets or going through information about what they are using, they will use it wrongly and they don't get effect for it. So when you have need for using eye drops, just consult your eye doctors. So they'll tell you what right eye drops to use and in what dosing. So
okay, let me take you back a little bit. You know that in our society, hypertension is very prevalent, and so is diabetes. You know, I want to know how a diabetic patient or an hypertensive patient can take care of their eyes. You know, I need somebody to learn from you today because of this diabetic retinopathy, hypertensive retinopathy that we talked about. How can we manage so that that person does not go blind totally?
Okay, so if you're hypertensive or you're diabetic, the first thing you need to do is to make sure that the blood pressure level or the sugar level is always within normal range. That's the first way you can take care of your eyes when you're having hypertension or diabetes. Make sure that your reading is always on point, is always checked. When your sugar don't go up all the time, when it's not elevated all the time, when your blood pressure is not elevated all the time, it won't affect the eye. There won't be a feedback. It's only when it becomes elevated, that's when it escapes to the eye. So just watch the level of your blood sugar or watch the level of your blood pressure, and then your eye is fine. You won't go blind that way.
Okay, for those of you who may want to continue with this conversation after we're done, give us a call on 080-3218-4887. The number again is 080-3218-4887. That's 887, okay? Give us a call, and then you can call us now on 052-290-573. We're going to take just a few calls, and then we'll wrap up the show. 052-290573. I know you want to ask Dr. Wamari something about your eyes. Is there anything you're going through, particularly those who are diabetic, who are hypertensive, and those who have other health conditions? Doctor is very passionate about caring for children and their eyes. Peradventure, you have a child or two, or you know of any child who is going through some kind of eye problems, you can pick up this number, call it later, and let's see how we can help deal with that issue. 08032184887, and then our call line is right there on your screen. Give Dr. Uwamari a call, okay? If you do that, I'm sure you will be happy too. The number is on your screen, okay? So how often should one change glasses while we're waiting for calls? Because I know of somebody who has been using hard glasses for so long. We even joke about it, that you and your glasses are the same age, you know, that kind of a thing. So how often should we change our lens?
Okay, so like there are different refraction errors in the eye and age groups too. So if you fall 1 to 30 years of age, you can use your glasses for up to 5 years,
Really?
6 years. Depends when there's changes in the refractive state. You wearing the glass will know that, okay, there's already...
Okay, we have a call. Hello, caller, good afternoon.
Good afternoon, madam.
Thank you. What's the name, please?
Angela.
All right, Angela, go ahead.
Happy Valentine, ma'am.
I wish you same.
Yeah, please, I want to ask Dr. Wamere this question.
Go ahead.
Sometimes I can't look directly to the cup, as in cup.
You can't do what?
Look directly to the sunlight.
Okay, you can't look directly.
Or the bulb fixed in the house.
Okay.
So when I look directly to sunlight, even I take my eyes off, as if I'm seeing some little dark thing. So later it will go up gradually.
Okay.
And sometimes the eye scratches me at times. So please, want to know. Thank you.
Okay. Have you been to the doctor already?
No.
Okay, Dr. Wa, you got that question, yeah?
Yes, that she can't look into the sunlight directly.
Sunlight directly.
Okay.
She can't look into
Light
electric
bulbs,
and all of
directly.
that. Okay.
Okay. Okay. The reason why you're having that photosensitivity, that's what we call it, is because your eye, the cornea, is sensitive. That's just the reason why.
That's just the reason.
That's just the reason why you can't look into sunlight, and then you can't look at bulbs without irritation. Okay. So, and the eye could also be dry, what we call dry eye syndrome. So what you just need to do is to visit in the nearest eye clinic to you. I don't know where you are, so I can't tell you come to whatever clinic. So the nearest eye clinic to you, just go and complain. There's a particular eye drops that definitely will be given to you. And then it can give you some photo lens to put on as well. Okay. That will be friendly with the sun, just like what I'm putting on. When I look at the bulb or the sunlight with it, I'm very comfortable. So if you understand the level of your sensitivity of your eye to those lights, then you should report to the clinic.
All right, give us a call after this time out on 08032184887. This is all we're going to do today on the program, Healthy Living. I want to thank you, Doctor, for finding time to be with us today.
Thank you very much, sir.
Okay, and for our viewers out there, thank you. Bye-bye.